So Dr. Trout was the first woman who was officially granted a license to practice in Canada. She wasn't the first female physician practicing, but she was the first one who was given the official go-ahead to practice legally and with the credentials of a full physician. So her legacy is to have really pushed the boundaries in medicine in Canada and to really demand that women were allowed a stake in practicing medicine and were allowed access to medical education.
She was young when she came, so she was like most Canadians. We're nearly all immigrants at some point, some generation. So she was born in Scotland, but she really was raised in Canada.
Advocating against the adversity and the hostility that she experienced, both trying to get into that medical qualifying course and, persisting with it, sticking through it. When she wasn't allowed to attend medical school here, she went elsewhere to attend, but then came back to practice in Canada. So that's all very inspiring for us. But then in addition to that, she had direct actions in helping to pave the way. So direct actions in facilitating the start of women's medical colleges, which was the start of normalizing women in the medical profession.
Their roles in medicine and society, challenging the status quo. She was just a doer to make a difference for women. She started a clinic. At that time, it was the most advanced type of medicine for individuals, which was called galvanized baths and electricity. She opened the clinic for women because you have to understand, in the Victorian times, women didn't get the kind of medical care that men did from male physicians. It was 6 houses on Jarvis Street. She could house 60 patients at a time. She also opened 3 more clinics, one in Hamilton, one in Meaford, and one in Brantford.
She was very true to her principles and really worked hard, so I think that's inspiring too. Someone who is very true to their principles and is really willing to put in decades of effort to do what they think is right.
So although it's more than 100 years since Dr. Trout had to deal with a lot of obstacles and a lot of pushback from community members, colleagues, patients, because she was a woman who wanted to practice medicine, there are still struggles and challenges that at this day and age, women physicians and specifically IMG deal with. It may not be as obvious as it was 100 years ago, but it's there. It's subtle, but it's there.
So as of 2021, the Canadian Women in Medicine organization marks the legacy of Dr. Trout and her accomplishments in being the first female physician to obtain licensure in Canada by celebrating Canadian Women Physicians Day. And it's actually celebrated on March 11th every year, which is the actual date that Dr. Trout achieved her licensure in Canada.
At some point, she was approached to support and sponsor a medical school for women in Ontario, and she agreed to support it with a generous donation with the stipulation that the majority of the Board of Trustees should be women. She was smart. She knew that to make change, you have to have women making those decisions to change.
I think Dr. Trout teaches a lesson of perseverance and working hard to achieve your goals despite adversity. She wanted to be a physician. That was no easy task at the time, but somehow she made it happen, and here we are now.
Fearless advocate for women in medicine. Canada's first licensed female physician and forerunner of gender equity in healthcare. Canadian Medical Hall of Fame laureate, Dr. Jennie Trout.